and welcome to my channel. My name is Jazzy RN. I've been a utilization review nurse for over 9 years, and today's video I'm going to help you find a nursing job that's either part-time or per diem or remote. So the first company is with Peace Health. I just typed remote in the job description and find jobs, and it came back with a total of 9 remote jobs. So we're going to focus on the RN Utilization Management Reviewer. That's per diem. So this position is for a per diem nurse. You are remote in the state of Oregon, Washington, or Alaska, and the work type is per diem relief. Just a FYI, the first thing I go to is the qualifications on what is needed regarding the job. But also, I do want to mention that if you are lucky enough to get the interview, the job description itself is the best way to figure out what questions to ask during the interview process. So this one says what you'll do. This is the job description. And this bullet point that says gather additional clinical documentation to validate treatment plans and level of care. So let's say you get an interview with this job and you're asking questions to the hiring manager. Then you can ask him or her, regarding clinical documentation, would I gather additional information via fax? Would I be faxing clinicals? Would I have access to the hospital's electronic medical records? Or will I be calling the hospital directly to ask for additional clinical? So that's a good question to ask. So make sure that whenever you do get the job interview, go back to the job description to see what questions you should create and ask to the hiring manager. So first we'll focus on the education requirements, what you bring. And it says required a Bachelor's of Science in Nursing, preferred a Master of Science in Nursing. Now the experience they want you to have, as you can see this is in bold, 3 years of acute care hospital experience with strong clinical knowledge. Now this was not in bold. It's in-depth understanding of Medicare or Medicaid, UM just means utilization management, regulations, RAC, QIO, MAC, and denial appeals processes. Now the company will teach you all this information here. If you have a previous experience with, let's say, utilization management, you're not going to go to a new job and know all of their Medicare, Medicaid regulations, because how their regulations were may be different from whatever the ones you were dealing with the previous job. Second, they want you to have a prior experience in utilization management or case management. And this is preferred but not required. And of course, they want you to have an active RN license in Washington, Oregon, or Alaska. So the next company we'll go over is Cerner Health. Now this one, I just typed in nurse and find jobs. At first I tried nurse and then remote, and the results came back as 0. So this company has 55 nurse jobs available, and this is actually internationally, so you can find jobs in the United States, Australia, I believe I saw something in Colombia, etc. And in France, so on and so forth. So the first job we'll focus on is the research nurse, which is per diem. And this is actually in person in Miami, Florida. And they want you to be bilingual, English and Spanish. So we'll go to the qualifications first. And of course, make sure that whenever you do get an interview, to look at the job description to figure out what questions you should ask. You're going to ask the best questions you possibly can to show that you've been researching the company. And also, Cerner Health is actually a global company. So we'll go to the qualifications. And for this one, they want you to have either associate's or bachelor's degree in nursing, 1 to 2 years of relevant nursing experience. This basically is just bedside. Proficient in Microsoft and Excel, familiarity with clinical software a plus. Now, clinical software is something such as Epic, Cerner, Meditech, Protouch. Whatever platforms you learn in either nursing school or in a hospital or nursing home you worked at, make sure you add those platforms that you've used in your resume. And an experience in research or regulatory environment is an asset. So they said it's not a requirement, they just said it's an asset. The next job we'll go to is research nurse per diem, and this is actually a location of Morrisville, North Carolina. This is a per diem position. And we'll go down to the qualifications for this one as well. They want you to be an RN with a minimum of 2 years post-qualification experience. So that means you've actually worked at the bedside for 2 years after you graduated nursing school. They want you to have research and clinical trials experience with GCP certification, knowledge of research design and methodology is desirable, etc. I do want to point out, if you don't meet all these requirements, I would say still apply, because they can train you about research trial, clinical trials, and GCP certification. And also right here where it says the ability to work autonomously with initiative in a team, etc. These bullet points, you actually can use that in a summary below your name, city and state, phone number, and email address on your resume. These are really great soft skills, and it's good to just place it all in one little area in a summary in your resume. The next job we'll go to is Dartmouth Health. This is actually a part-time position. This is actually 16 hours per week. Now this position is kind of strange how they posted it, because at first it says this role is 100% hands-on, and then when you scroll down, it says 100% remote position, requires reliable internet and a secure HIPAA-compliant workspace. Now just a FYI, a HIPAA-compliant workspace is basically a room that you'll work in with a door that locks. Now this is not necessary, because the 3 companies I've worked for, I've always worked in my living room. I never worked in a separate bedroom or office in my home that has a locking door. My front door is locked in my home, and I'm actually working next to the front door. Just an FYI. This is actually a day shift position. It's weekends only, and they want you to have an associate's degree, which is required, but a bachelor's degree is preferred, and previous experience in remote triage, nurse advice lines, or outpatient clinical settings. Even though you don't have this, you can always just edit your resume to where it relates to remote triage. It relates to nurse advice lines and outpatient or clinic settings. And the next position is also with Dartmouth Health, and this one is a per diem position. And this one has the same exact criteria or information on it regarding this role is 100% hands-on. But then you scroll down, and then it says 100% remote position, requires reliable internet and a secure HIPAA-compliant workspace. Same here. The qualifications must be associate's degree, RBSN, and then previous experience in remote triage, nurse advice lines, or outpatient clinic settings. I do want to add, it does want you to have requirements such as Epic, EMR. It doesn't say what type of remote communication systems. So I would also mention that I'm guessing they mean Microsoft Teams. That's a remote communication system. Minimum of 2 years clinical experience with strong background in triage, the ED, or primary care. And also I would just suggest you to edit your resume to where it relates to triage or how it relates to emergency department. Because you have emergencies on the floor in med-surg and primary care. And these 3 bullets down here, these last 3 where it says the excellent assessment, critical thinking and decision-making skills, strong communication, documentation and time management abilities, and self-motivated and comfortable working independently in a remote environment. You can actually try to combine all these 3 bullet points into one summary, maybe a 2 or 3 sentence summary on your resume. And last but not least, I created this free list of over 60 companies that hire nurses to work remotely. I have a link. The link to this is actually in the description box below. And it also includes, when I scroll to the very bottom, I want to mention this one company in particular. It's called Lensa. If you do look for jobs on LinkedIn, you want to avoid applying directly through Lensa. Whenever you see a Lensa job and the job itself they will post the name of the company that actually is hiring. A lot of times it's United Healthcare, Molina, multiple other companies, but don't apply directly to Lensa. Just look for the company's name on the job description and then apply directly that way.